Good morning, my name is Jason Ryder. Good afternoon. I'm unsure exactly what time it is. I have an idea about getting people signed up for insurance. Let's take a look at all of our COVID-19 testing that's happening around our country right now. Let's go ahead and use this as an incentive or an opportunity to get people insurance. For example, I don't have insurance, but I've got to get tested to find out if I have COVID-19 or not. So I go in, I have the test done, free of charge, and this means then that the manufacturer of the test then eats the cost of the test. So that means the manufacturer of these tests are creating all these free tests. It's going to cost them money out of their pocket, but we're giving them to Americans to be tested for free. Then what happens is, now that you've gotten your test done, then that day, right lickety-split on the spot, you're signed up with Obama Healthcare. The enrollment fee of $350, if there is such a thing, is waived, and there is no penalty at the end of the year on your tax return if you have no insurance. I got this idea when I was looking at medical coding or billing codes and looking at associate degrees to help me identify multiple service codes for the same service in order to streamline costs or inventory and be sure that we're charging fair amounts, if not one price. For example, let's say the cost of an HIV test can be charged at what Walgreens store HIV test is, which let's say is roughly $50. All right, and that let's say that the company B that is providing the HIV test codes it as NIV. And then let's say somebody goes to the San Antonio AIDS Foundation, which is nonprofit, and it costs San Antonio AIDS Foundation $250 to administer an HIV test, right? That they absorb or pay out of their pocket to get, or get grant money to cover. Either way, they code that in their system as LIV, right? So now we have two prices that are translate into unfair amounts. But that got me thinking too, then why can't we get people signed up with insurance and using the Obamacare program? Also with some other options to include TRICARE, that's if Social Security Administration will fall under the Department of Veteran Affairs umbrella, all right? Or use Blue Cross, Texas Blue Cross Blue Shield, Aetna, or the company in Hot Springs, I cannot remember the name of it, but that administers the United Healthcare Plan. But some options. That way, folks, Obamacare does not go away. People are signed up. The fee is waived, right? We have a chance to work out the bugs in the system, and it becomes an affordable replacement of Medicare. Socialized medicine for all. We all have a right to health care. The doctor's Hippocratic oath state that the doctors take an oath to save lives. And that means that we have to do our part. And our president, commander-in-chief, did his very best to be sure that the doctors are not stuck out alone, that they know that their patients are doing what they can, right, to save their own life. So it takes insurance and the doctor. So this would be a great opportunity during this crisis and pandemic to shoot for 100% everybody signed up with healthcare insurance.